Pay close attention. What you're about to see is Bible prophecy being fulfilled.
Welcome to another edition of YPN News, bringing you news as it relates to Bible prophecy and foretold by Yisrael Hawkins. We're going to talk a little bit about the fentanyl epidemic, which hasn't really decreased at all, but of course, adding to the problems and the deaths we saw from 2023, we're seeing more in 2024. Of course, bird flu continuing to spread from dairy to dairy to dairy farm. And of course, the question is, how is it going to affect humans? We're also going to see some of the protests that have been taking place nationally and many places throughout the world, including Israel, because of the war in Gaza. And lastly, we're going to hear from a senator, one of the U.S. senators who is actually a proponent for nuclear bombs. But first, we're going to start off with the fentanyl epidemic, which, of course, is of growing concern in the United States. DEA agents say they seized more than 16 kilos of fentanyl powder and 60,000 fentanyl pills in May and are working to break up more drug rings. Dr. Sutton, ABC medical correspondent, spoke on the effects of the fentanyl crisis on families and said that the numbers are very concerning. 38,000 Americans were killed in the first 6 months of 2023, and over 115 million pills seized that same year.
38,000 killed in the first 6 months. That is a lot. Well, in the emergency room, many patients who are brought in for an overdose said that they simply did not realize the threat that existed. Now, other medications that are taken, sometimes fentanyl, is added to them to increase the potency. And fentanyl, of course, is cheap to produce. It's cheap to make, easy, accessible, but of course, extremely dangerous. Now, 1 milligram, a fraction of a raindrop, you heard that right. Wow. 1 milligram, a fraction of a raindrop, can be deadly.
Oh, interesting. He concluded by saying that people can be aware of an illicit drug overdose by recognizing the signs, which is unresponsiveness, pinpoint pupils, delayed responses, and also knowing what to do next.
Well, drug-resistant superbugs are killing 1.3 million people a day. Why? Well, take a look at this next video for more on the growing superbug crisis. Take a look.
Now let's talk about the next pandemic. Of course, no one wants it, but it's not something you can wish away, so it's best to be prepared and be informed. Where will the next big outbreak come from? It may not be like the Wuhan virus. It may not even come from a wet market or a lab. In fact, it could be in the making as we speak. I'm talking about drug-resistant superbugs. They're immune to antibiotics. They pose a significant risk to humans, especially in India. These bugs are taking thousands of lives every day. Every year, drug-resistant infections are killing at least 1.2 million people the world over. That's about 3,500 deaths every day. Many of these patients are dying of infections that are completely treatable. And we're talking about all kinds of infections here: bacterial, viral, fungal, parasitic, like pneumonia, tuberculosis, and malaria, just to name a few. They're all becoming harder to treat. Existing medicines aren't working very well. Proven drugs are failing to treat patients. Why is that? Because the bugs have built resistance to medicines, and Indian patients are particularly vulnerable. In 2019, a study was conducted. It looked at drug resistance in 41 countries to see how effective antibiotics are among different populations. 41 countries, and Indian patients were included in this research. A rating was assigned to every country. They were marked on a scale of 1 to 100. A low score meant the drugs were effective, and a high score showed significant drug resistance. Guess who got the highest score? India did. India's rating was 71.6, meaning there's a higher chance that antibiotics won't work in India. They won't be effective in treating a larger number of Indian patients. And why is this happening? Because antibiotics are often misused in India. Patients pop them for anything and everything. In many cases, people just self-diagnose and they start taking antibiotics without a doctor's prescription. In other instances, doctors prescribe them even when the patient doesn't need antibiotics. And we have data to back this claim. It is from India's National Center for Disease Control. Again, this was a survey of 10,000 patients. And here is what it found. In more than 50% of the cases, more than half the cases, antibiotics were given as prophylaxis, meaning a preventive drug. The patients did not need an antibiotic. The idea was to preempt and stop the infection. That's why they were given it. Only in 45% of the cases, antibiotics were given to treat an infection. So basically, patients are popping antibiotics like it's candy, and this is dangerous. This overuse is what leads to resistance. Viruses and bacteria learn how to survive these drugs. So when the patient genuinely needs this medication, it is no longer effective.
Well, these are, many long-lasting diseases that have been around for a long time. She mentioned tuberculosis in there as well. But of course, they've, over the years, built up a resistance because of the tremendous amount of antibiotic use that are pretty much in everything we encounter in society.
Right. We're actually making these bugs what we're calling superbugs because of the overuse of antibiotics. They're just now, they keep mutating,
right.
Adapting really to and fighting off so that the antibiotics don't even work anymore.
That's right. Sad. Well, bird flu is spreading to dairy farms, but what about the risk to the human populations? Well, the next video that you're going to see will shed some light on the concerns that many of you might have. Let's take a look.
4 years after the start of the pandemic, hospitalizations for COVID are at an all-time low. But there are new variants, and now bird flu is in the headlines. It's been found in at least 36 dairy herds across 9 states. But so far this year, there's only been 1 confirmed human case. So how concerned should we be about all of this? So Caitlin, how concerned should we be about bird flu?
Yeah, what's clear is that this is continuing to spread among cows and other animals, but the risk to the general public is very low. And this really means there's nothing we can do other than don't touch dead birds or animals, don't drink raw milk, and maybe even call your congressman for better biosecurity support. But this is definitely not March of 2020, and it's definitely not even January of 2020. But of course, the situation can change, and usually with outbreaks, it can change very quickly. I think that alarm bells for the general public should really start going off if we start seeing human-to-human spread. Right now, it's really an all-hands-on-deck response for public health to prevent another pandemic and staying laser-focused on protecting the small group of Americans that are at higher risk, and that is dairy and poultry workers right now.
Another thing that's caught a lot of people's attention was the report that the FDA had found dead viral fragments in milk bought at grocery stores. That sounds pretty scary. How concerned should people be about that?
It is scary, and it does sound scary, but I calmed down when I knew that we have over 100 years of data on the effectiveness of pasteurization. Also, just to confirm that the pasteurization was working, the FDA tried to grow active virus from these pasteurized milk samples from grocery stores, and the experiments failed, which is actually a good thing because that means these viral fragments were broken pieces that just could not replicate and thus cannot harm us humans. Since those studies have been done on the milk, they've also tested other milk products like cottage cheese and sour cream, and those are safe, as well as beef in grocery stores is also safe to consume. I think the bottom line here is just do not drink unpasteurized milk. It can make you very sick, especially at this time.
So that's bird flu. Let's talk about COVID. Tell us about these new variants that have the intriguing nickname Flirt.
Yeah, so what we know is that COVID continues to mutate, right? This is just what viruses do. The latest and greatest variant is Omicron, but with very small changes, right? These flirt variants have only 2 additional mutations on the spike protein. This is compared to about 50 changes that we saw with the huge Omicron wave back in 2021. So just with 2 small changes, we know that this isn't going to cause a tsunami of infection. It's just not different enough than previous ones. The question is whether it will cause a wave, a wavelet, or nothing at all. And unfortunately, time will just tell.
So only 2 mutations. Does that mean that if you got a booster last fall or since last fall, that would take care of it, that those variants would not be able to get around that booster?
If you're up to date on your COVID-19 vaccine, which for the majority of people means a fall vaccine. Some are eligible for a spring vaccine. And yeah, it's not a perfect match, but it will certainly help against severe disease and death. Because this has mutated a little, that may mean we'll see a little more infections than before, but you are very well protected against severe disease if you're up to date.
Is the COVID vaccine going to continue to be reformulated and keep up with these variants and sort of almost like the annual flu? They have to figure out what the dominant strain is going to be.
Yeah, that's exactly right. It looks like we're moving towards a flu model, right? So where COVID-19 vaccines will be updated every year to match as best as possible the circulating strain. The FDA meeting is actually next month, is mid-June, to make a final decision on what exact strain is in that vaccine. But to the general public, know that you can definitely expect an updated vaccine this fall again.
Well, Katan, it's kind of the same thing with these superbugs. These COVID-19 variants there are becoming smarter, and they're actually finding a way to get around the vaccine. So, as we just said, there's going to coming a vaccine out probably each year to try to keep up with the variants that are coming from the COVID-19. So I guess many people will look forward to going and getting their yearly shot for the COVID-19 vaccine. Interesting. Well, more tariffs on Chinese products, $18 billion worth of Chinese imports. Now, this includes quadrupling tariffs on Chinese electric vehicles from 25% to 100%. Now, it also affects batteries, medical equipment, steel, and solar cells. Now, the administration said that this move will protect industries from cheaper Chinese products that they warn could wipe out the competition.
Well, protests against the war in Gaza have been going on for weeks at universities all across the United States, as well as in Israel. But conditions for Gazans are getting worse by the day. Please take a look at this report from CBS Weekend News at the situation.
Nationwide protests over the war in Gaza and President Biden's approach have inflamed dozens of colleges and universities, stoked tensions in the Democratic Party, and created new challenges for his re-election. Today, more pro-Palestinian protests as dozens of graduating students walked out of their commencement at Virginia Commonwealth University in Richmond. Across the country at the University of California at Berkeley, commencement began peacefully, but was disrupted by hundreds of protesters, most of them graduates in cap and gown. And tonight in Gaza, some 300,000 Palestinians in the city of Rafah are being forced to flee once again as the Israeli military prepares to target Hamas.
Good evening. Israel's war cabinet has greenlit a new military advance on Gaza's southernmost city. Thousands of people in Rafah are right now evacuating to the coast on top of the more than 100,000 that fled in the past week. Ramping up, the exodus from Rafah. Gazans heeded Israel's newest warning sent by texts and flyers from the sky. You are in a dangerous combat area. The IDF is about to operate with great force. We're leaving because of our fear and because of coercion, said this woman. We're leaving for the unknown, and there are no safe areas at all. All the areas it says are safe are unsafe. More are overflowing further up the coast, like Abu Mohammed al-Radi and his family. We came from Rafah and found no place to stay, he said. There isn't enough space for all the people. There is not enough space to hold the displaced people. What's left in Rafah is eerie abandonment, even journalists wrapping up their final stories. At the city's biggest hospital, a quiet acceptance more death is coming. Hamas is still fighting back with missiles and with media. This new video praises snipers shooting Israeli soldiers. Israel's army released its own, troops advancing through Gazan homes. But tonight, Hamas also released this video. A 51-year-old British hostage. They claim he died after an Israeli strike. Tonight, more protests across the country and outside Prime Minister Benjamin Netanyahu's house in Jerusalem. These protests have been happening for months. They're saying, bring the hostages home. Their blood is on the government's hands. Protests have swelled in recent weeks, calling for Netanyahu's ouster and for that ceasefire with Hamas.
Yeah, Katan, you can see there that the Gazans are just really running out of places to go. They've gone so far up to the seacoast there. I mean, we saw the tent cities, but they're just packed in there. There's not enough room for everybody to flee those areas that Israel is saying is going to come under heavy military presence. So there's really no place for these people to go anymore.
And it's not worth the risk of just hunkering down and staying, because they've already seen in times past, if Israel say they're going to do it, they're going to do it.
That's right. Well, Russian forces have carried out a large-scale offensive in Ukraine's Kharkiv region, which has caused the fighting there to intensify in a big way. Not just thousands, but tens of thousands of Russian soldiers were congregating at the northeastern border of Ukraine, trying to break Ukraine's defensive line. Now, the surprise attack was carried out with guided aerial bombs from the sky and heavy artillery on the ground.
Oh, the fighting was so fierce, fire and smoke can be seen in satellite images over the region. First responders tried to put out the flames of Ukrainian homes set ablaze during the attack, which so far has caused 2 people to be injured. Many families have been forced to flee their homes due to heavy shelling.
President Zelensky said in a statement after the attack, quote, "We are adding more forces to Kharkiv, both along our state border and along the entire front line," end quote. Now, some think the attack comes while Kyiv waits for more aid from the U.S. And we just spoke about that $400 million aid package that the U.S. announced it would be sending to Ukraine. Now, that aid includes Patriot missiles, artillery, armored fighting vehicles, among other things.
That's right. John Kirby, a United States National Security Advisor, told the press he sees the very real possibility Russia will continue to try to advance on Ukraine, but said, quote, "The influx of U.S. assistance will enable Ukraine to withstand these attacks over the course of 2024, end quote. Many had been fearing a full-scale offensive from Russia and believe this could be the start. So Ukraine, of course, is pinning their hopes on the U.S.'s military aid.
And it looks like Russia is trying to hit them hard right now before they get all that aid that can carry them through the rest of the year.
That's right.
Well, NBC News anchor Kristen Welker could not get a word in edgewise with Senator Lindsey Graham after asking why Israel has to use such massive bombs instead of the more precise technology available to it today to minimize civilian casualties in Gaza. Now, Senator Graham compared Israel to the U.S. in the example from World War II.
Senator Graham said, quote, "Here's what I would say about fighting an enemy who wants to kill you and your family. Why did we drop 2 bombs, nuclear bombs, on Hiroshima and Nagasaki? To end a war that we couldn't afford to lose," end quote.
Well, Graham continued, "You don't understand. Apparently, what Israel is facing, they're facing 3 groups. Iran, who has received $80 billion in aid. They're taking that money to kill all the Jews. So when we were faced with destruction as a nation after Pearl Harbor, fighting the Germans and the Japanese, we decided to end the war by bombing Hiroshima and Nagasaki with nuclear weapons."
Graham insisted we should, quote, "give Israel the bombs they need to end a war they can't afford to lose and work with them to minimize casualties." Well, the senator speaks directly to the Jewish state and talks over Welker, saying, "Israel, do whatever you have to do to survive as a Jewish state, whatever you have to do."
I can tell you, we've talked about the huge population there in Gaza. And these people, as we showed, they're already packed into these areas that they're supposedly saying are safe. if, just consider for a minute, if Israel would go ahead, as Lindsey Graham said, to go ahead and use a nuclear weapon, the amount of casualties that we would see coming out of this, it seems just preposterous for a senator, somebody who is supposed to be, kind of an advocate for the people, and he should have the common sense. I know that's what he's thinking, to go ahead and use nuclear weapons, but is he not considering the amount of destruction that these nuclear weapons would have on those people?
Yeah, and a lot of times people like that, with that type of mindset, feel it's okay to use on somebody else, but of course they don't want it to be used on them and to affect them, their family, and their country. The people who have suffered these things, many of the people have been interviewed. There are a few surviving people who were alive during the time of those bombings in 1945, and they don't want anything to do with nuclear weapons. They saw the destruction firsthand, and of course they've called for many years for countries to actually work to get rid of those things. But of course, the nations are continually stockpiling, advancing them, because they see it as the only option to win a war.
Right, and we've been 75 years since that time when those nuclear weapons have been used. Think of the technology today and how much greater and stronger these nuclear weapons are, and more destructive. It just is unthinkable what's going to take place when when these nations do use nuclear weapons.
And the experts say 30 minutes to an hour for one of those missiles to reach their target once they're launched. Yeah. That's it.
Well, if you want to find out more about these stories, contact the House of Yahweh. When you do, don't forget to request your free copy of the monthly newsletter and Prophetic Word magazine. Here's how.
To contact the House of Yahweh, you can write them at The House of Yahweh, P.O. Box 2498, Abilene, Texas, 79604. You can call them at 1-800-613-9494. Visit any of their websites by going to Yahweh.com, YisraelHawkins.com, or Yahweh'sBranch.com. You can also visit our website by going to YPNnews.com. You can email the House of Yahweh at info@Yahweh.com. And for all calls outside the United States, please dial the number on your screen. And don't forget the Yisrael Says and Ask Yisrael programs online, available to aid you in your study and understanding of the scriptures and the prophecies. You can find those by going to YisraelSays.com and AskYisrael.com.
Well, don't go anywhere. Up next is another classic message from Yisrael Hawkins. From all of us here at YPN News, I'm Jeffrey Heimerman.
And I'm Katan Alexander.
Thanks for watching.